Hi everyone, I will be discussing physiological changes that occur during the postpartum period. This will include common discomforts and comfort measures as well as pertinent nursing considerations. Postpartum is the period between the birth of the placenta to 6 weeks after birth, or when the body has returned to a non-pregnant state. The main physiological process that is happening during this time is involution of the uterus. This is when the uterus is contracting and compressing as a way to control the bleeding from just losing an organ, aka the placenta, and is marked by a rapid reduction in size, which is monitored by the fundal height, as well as the presence, consistency, and type of lochia. Following birth, estrogen and progesterone levels decrease dramatically, causing uterine cells to atrophy and the hyperplasia to reverse. The decidua, or mucous membrane that lines the uterus during pregnancy, casts off as lochia in a series of stages. In the first 48 to 72 hours after birth, the outermost layer and middle spongy layer die and shed, and the basal layer underneath the spongy layer differentiates into two layers. The glands of the myometrium, which is the outer layer, lay the foundation for the new endometrium. Within 3 weeks, the new endometrium has formed everywhere except the placenta site, which takes about 6 weeks to heal. This essentially happens through a process of exfoliation. Some blood vessels are replaced with smaller vessels. Proteolytic enzymes and macrophages promote autolysis and the breakdown of uterine proteins. All of this explains what we are seeing with the lochia. In the first 2 to 3 days after birth, the lochia is a dark red. We call this rubra, and it contains those epithelial cells, red blood cells, leukocytes, etc. Then in the 3 to 10 days after birth, we start to see more cervical mucus, and the red blood cells start to decrease until the lochia is a yellow-white color, primarily made of white blood cells, cervical mucus. There are variations in how long these stages last, but it trends towards lighter flow and color. The total lochia volume is about 225 milliliters, which is less than 25% of the normal total blood loss in the postpartum period. When the lochia stops, then the cervix has closed and the risk for infection decreases. Now, with the fundal height, the top of the fundus comes to the umbilicus within 6 to 12 hours after birth. It then decreases by 1 centimeter per day for 10 days. If it is not midline or at the umbilicus in the first 24-hour period, and we know that the mother has voided recently and completely, then there is concern for hemorrhage, as this indicates that there is a problem with the uterus contracting. There may also be slower involution if there is an infection or if the uterus was much larger to begin with, like in the case of multiparity. Ways to enhance contraction of the uterus include breastfeeding, which releases oxytocin, as well as early ambulation, which helps increase muscle tone. Some common discomforts that occur during this postpartum period include chills, afterpains, and flatulence. There are lingering progesterone effects and decreased muscle tone following birth, which may cause flatulence. It can be relieved by early ambulation, which will help increase muscle tone, as well as anti-flatulent meds and GI soothers like chamomile tea or peppermint tea. Postpartum chills are also common, and they may occur due to the sudden release of pressure on the pelvic nerves, or a response to adrenaline, or maybe your reaction to the epidural. As long as the chills are not presenting with a fever, then there is no concern. We can cover them with a warm blanket or provide a warm beverage. Similarly, the body may respond to this contracting uterus with afterpains. This is more common with multiparas, as they are not contracting as consistently as primiparas. The administration of oxytocin is going to increase this discomfort, as well as the oxytocin that is released during breastfeeding. So we can provide a warm bottle against the low abdomen or provide a mild pain reliever 1 hour before breastfeeding to reduce the discomfort. Now I would like to discuss some things that we may see on assessment or with vitals and lab values. Starting with neuro, it should be known that headaches are common within the first week when estrogen drops and there's massive fluid shifts from losing an organ, the placenta. Headaches may also occur due to stress, hypertension, or leakage of cerebrospinal fluid during spinal anesthesia. If the mother has a history of migraines, epilepsy, multiple sclerosis, myasthenia gravis, or Guillain-Barré, the first month is critical for monitoring any exacerbations. Women with epilepsy are 9 times more likely to have a seizure in the first 24 hours after birth, and migraines are known to reoccur in that first week. Moving down to cardio, there is cardio instability within the first hour after birth due to the increase in cardiac output and volume from blood that is no longer traveling to the placenta. This protects the mom from excessive blood loss. Cardiac output will decline in the first 2 weeks and reach normal levels around 6 weeks. Excessive urinary output helps decrease the extracellular fluid, and if the mother isn't experiencing this excessive urinary output, this may lead to pulmonary edema. Immediately following birth, the mother is going to be hungry and thirsty. It is important to encourage adequate fluids to replace the fluid loss. If the mother had a C-section, then they'll need clear fluids until the bowel sounds return, and then they can eat. It is also important for mothers to know not to delay going to the bathroom, even if they had an episiotomy, laceration, hemorrhoid, etc., because the constipation is going to make the pain worse. The uterine ligaments in the abdomen are completely stretched at this point and require the full 6 weeks to recover, similar to the rest of the abdominal wall, but good news is that it responds well to exercise. Mothers who had poor muscle tone pre-pregnancy and also mothers who had a C-section will experience a separation of the abdominal muscles, but again, this will respond well to exercise. And the striae is going to turn darker and then fade. So the interventions here are mainly education and reassurance that this is all normal. Immediately after birth, the bladder capacity greatly increases and fills due to the fluid shifts, yet the sensitivity to fluid pressure decreases due to stretching or maybe the anesthesia block. It is important to encourage using the restroom every 2 to 3 hours or so, even if they don't feel the urge, because they probably won't, and this is an important measure to decrease the risk of hemorrhage. A full bladder is going to interfere with uterine contractions, and we don't want that. The cervix, vagina, and perineum are also going to be healing during this postpartum period. At first, the cervix is spongy and opens to about two finger widths, and it appears that the vagina and the perineum have edema. But within the first week, the cervix decreases and firms to allow about a fingertip, and within 3 weeks, the vagina size decreases and the rugae return. A lactating woman will have low estrogen due to ovarian suppression, and this may lead to painful intercourse, so it is important to use a water-based lubricant. It is also important to note that sexual intercourse is contraindicated until the perineum has healed from any lacerations, which will take about 6 weeks. To improve muscle tone and contractility, the mother can perform Kegel exercises like soon after birth. With vital signs, we may note an increase in temperature in the first 24 hours due to exertion and dehydration. There will also be a rise in systolic and diastolic blood pressures from the excessive oxytocin. There may also be orthostatic hypertension in the first 48 hours due to abdominal engorgement. A low blood pressure may indicate hemorrhage, but this is a late sign. Preeclampsia can persist or first appear in the first period, so always be monitoring the blood pressure, especially as it appears with a headache. A slow heart rate will occur in the first 6 to 10 days due to cardiac strain and decreased blood volume. An increased pulse may indicate hypovolemia or infection. There is also an increase in white blood cells during labor that returns to normal by the end of that first week. The blood loss in the first 24 hours causes hemoconcentration, so there will be a rise in hematocrit. After 3 to 4 days, the interstitial fluid leads to an increase in plasma volume, and then there will be hemodilution. So the platelets also will first decrease with placenta separation, and then they'll increase in 3 to 4 days. And by 6 weeks, the blood values will have stabilized. So this concludes my presentation. I hope it will help you study the postpartum period. Thank you for watching.